Hi, and thank you for joining me today. My name is Jacqueline Horton. You're welcome to just call me Jackie. Today, I'm just going to talk with you about my virtual wellness and health platform that I'm beginning, and then actually today. So, basically, my name is Jacqueline. I'm a clinical social worker and have been a social worker for a lot of years. I started to get involved with health and life coaching about 3 years ago, and I have loved it ever since. So, what you will expect from my platform, from my virtual channel, is three things. I'm going to be promoting wellness and health. I'm going to be amplifying long lasting solutions. And I'm also going to be identifying things that we can build upon as part of our strengths and not look into our deficits. So, just to give you some background on why I'm here and how I got here, it's a little story. Okay. So I began to work as a social worker years ago and really enjoyed my profession. I don't have any regrets about that at all. And because of that, I learned to really work with people in different ways and in different settings. So, one of the things that in social work school we learn is to really understand the person in his or her environment. I like to draw a little circle because we're all sort of involved in some kind of circle of life that we live. And within those circles, we have little small circles that impact our daily lives, such as our social circle, our professional circle, our faith based circle, and so on. So, as a social work student at Howard University, when I was in graduate school, I initially focused on macro level social work, in which I was looking at policy, community organizing, and administration. However, once I got out of school, I didn't find a setting that I can work with a director who sort of was able to encompass all that and also develop me into that administrative social work that I initially thought I wanted to become. So, over the years, I have worked in a variety of settings from foster care to private practice to hospital, inpatient, outpatient, community based. And it has been wonderful. Along with me developing my skills and my knowledge, people would come up to me and encourage me and state, "Hey, have you thought about, starting your own business, working for yourself, and bringing in people to hire and train and so forth?" I looked at that as a compliment. However, I was pretty sure I was happy with working for somebody. I was pretty okay with having a every 2 weeks check, and I was very much okay with implementing the vision that the organization that I had worked for. Very easy for me. However, over time, I became a little bit more hungry in wanting to get back into community, social work, look at policy changes, how it's impacted people, and so forth. And so my last area where I worked was in healthcare, and it was like like a volcano that went off because healthcare provided me with that full circle of working with people. In healthcare, I was able to work with mainly internal medicine doctors who really address chronic disease issues. And when they would come to me and ask for my expertise, I would also go to them to get some knowledge, some medical and clinical knowledge to also help patients that they felt need to see me as a therapist or as just a social worker. And having worked with many specialists in the medical field as well as primary care providers, I just was like wanting to absorb more and more and more because that was the one circle of a person's full environment that I didn't have the knowledge for. So I sat and I contemplated. I was like, I'm not really interested in being a nutritionist. I'm not really interested in being a dietitian, although I think I have major respect for those professions. And I came across the Health Coach Institute in 2020, went through their training, became certified, and it just took off like lightning for me. I was able to now sort of like work with the clients or patients that the doctors were referring to me to address those barriers around their health, as well as those barriers around their social needs and their behavior needs. And so, one of the things that brought these two worlds together for me was how we operate as people. Whatever is here in our thinking comes out in our feelings, and then then it comes out in our behavior. And that circle continues until there's an impact or an interruption. And so, being that I'm in a field that's about preventative and also about helping improve, and being with a medical field that's also about preventative and helping improve, I sort of felt like these two worlds were going to align together. And I was kind of excited because I remembered writing a paper about having physical health and behavior health in one setting. So actually, I can say that I'm living out what I had always desired to do. So, with that being said, the way my the way my channel is going to work is that I'm going to be doing some daily doses, giving you some daily doses of just information. I am not here trying to provide, online therapy in front of the world. Neither am I here to provide, clinical or medical information because that's not my track. However, in the future, I will be bringing in doctors and medical professionals on my platform to just talk about a variety of things that are impacting, us as Americans. And so daily, you will see me, and I sort of broke it down almost like how I operate in my practice, which is called the Circle of Health, where, if you come to me, I'm going to be doing some spiritual, information sharing, and hopefully whoever needs it is finds himself being uplifted by it. Then Monday, I'm going to be looking at behavior health, but not from the sense of diagnosis. I am going to stay away from diagnosis because I think it's kind of insensitive to refer to people with a diagnosis when this is not your background, one. And the people who might suffer from those diagnoses, my experience is that they get more embarrassed and unwilling to reach out for support. So I will not be doing diagnosis. The way I'm going to sort of talk about mental health or behavior health issues is through the behavior itself. And then on Tuesday, I'm going to be approaching the health coaching part that I like to do. And the health coaching part is really bigger than just nutrition and diet plans and so forth. I'm really going to be really focusing on organ health. And that's one of the key components that I learned in working with medical providers, whether they're a nurse practitioner, internal medicine doctor, or family medicine doctor. But the organ health is what keeps us living longer and healthier, as well as keep us feeling younger too. And then Wednesday, I'm going to make it really fun. I am actually going to take you through my walkthrough of getting back into physical shape, or just getting more into what I call health moves, just moving. The body requires movement in order to stay, as we said, youthful and energized and ready. And so I'm going to have you share some time with me with my personal trainer. I may even lead some classes myself because I am a former trained dancer, and so I feel like I got something to offer you. And then I'm going to be working with the personal trainer Cyrus on some of the other physical fitness, weight training and strength based. So that's Wednesday. I'm gonna be doing dancing too, so you got to join me. And then Thursday, the second part of my certification is around life coaching, and I have a certification in career and finance, as well as love and relationships, as well as purpose for life. And so, like I said, my virtual wellness and health platform is really around information sharing, amplifying long lasting solutions, and identifying strengths that you can build upon. And then to conclude my week, which is Friday, I'm looking forward to hearing from you all. I plan to open my line and just kind of either choose a topic to talk about or take in some suggestions from you all of what you would like to talk about. I really think communication is a key to working with people. And so I don't mind having respectful dialogue. And keep in mind, some things would be some data, some stats, and then some things would be from my own opinion. And then I may even use some of the things to talk about regarding that's coming from my trained experience as a therapist. However, with that being said, I am not advising anybody to do anything, or I'm not in a position as if I am in a one-on-one session with you. So it's a lot different than being on this platform. So, with that being said, again, my name is Jacqueline Horton, and my channel is Jacki Horton at the Village Circle of Health. I would love you to join. And so, once as I conclude this, there's a couple of things I would like for you to do. One is subscribe to the channel. If you're here, I'm going to be here, and I'm going to make sure that I'm prepared to give you some information that's useful and that's interesting. The second thing is I would like for you to check out my website, thecircleofhealth.co, if you want to work with me individually, either in coaching or either as a therapist. And then the final thing is I have a health fair that's coming up in September with the A Wild Physique Jam. And we are planning a lot of great stuff. And so, what I'm doing here, we're going to be actually doing it live. And you can join virtually, or you can also join in the center, which is in Maryland. So, thank you for your time. And I pray that you have a great Sunday. And I look forward to seeing you tomorrow. Thank you again. Bye bye.